Joining me now to talk more about the influenza epidemic and what you can do to protect yourself is the president of the Canadian Medical Association, Dr. Alika Lafontaine. Dr. Lafontaine, thank you so much for joining us again. How concerned should Canadians be that flu levels have reached the level right now of an epidemic?
So I think it's important for Canadians to realize, even though we've been through a lot of the past few years, declaring an epidemic is actually a pretty big deal. So what does that allow us to do? It allows our levels of government to allocate certain resources that they didn't before. Some of this may go into tracking, some may go into supporting treatment or other areas. Also unlock certain other powers that they might be able to implement to mitigate this. But the real take-home message is this is very serious. This is not a regular flu season, and it's really overwhelming a lot of the capacity of the healthcare system right now.
Yeah, not a regular flu season, especially after historic low rates of influenza for the last year. I mean, that's likely because of social distancing and other measures. But was this something that we should have expected as masking and other COVID-19 precautions were removed?
So I think it is expected that as you start to move away from mitigation of respiratory illnesses, obviously you're going to get a bit of a spike. I don't think many people thought it would be as severe as it is right now. But I'd go back to what worked in the past. We know that social distancing, staying away from people when you're sick, really, really important. We know that masking worked because it decreased the rate of respiratory illness in our last round. Making sure that you don't purposely go out there and get infected if you don't need to, and taking it really seriously if you have a loved one who's at home and seems more sick than you're able to handle, you should head over to emergency, and even in the midst of what's going on in hospitals right now.
Weeks ago, you warned that the healthcare system was on the verge of collapse. When you consider the fatigue that healthcare workers are experiencing after 2.5 years of COVID-19, and now that there's RSV and the flu, are we at the breaking point? Are we just past that?
I would say it depends on where you're at right now. I think there's a lot of weathering that's occurred for healthcare providers. We've been through these crises over and over again. And I'll just say again, the most resilient part of any healthcare system is the people that work in that healthcare system. And we're trained to deal with this type of acuity. We're trained to deal with chaotic situations, but just the unrelenting nature of this and that we haven't actually made some systemic changes that could lead us somewhere different. I think it's really wearing on healthcare professionals right now.
Doctor, besides getting the flu shot, what should Canadians be doing to protect themselves and the healthcare system at this point?
So what do we know works? We know that if you're symptomatic, stay home and stay away from folks. Try not to spread it to other neighbors or loved ones. Masking does help, making sure that you wear the right type of mask depending on the type of illness that you're trying to avoid. That may be anything from a simple mask to something that's a little bit more aggressive, like an N95 or N99. Indoor ventilation is extremely important. And once again, just keeping track of what's going on with family members. I think there's never been a more important time for us to pay attention to, illnesses that we've taken for granted in previous years. And it's really important for us to pay attention and help our loved ones and those we care about.
Dr. Alika Lafontaine, president of the Canadian Medical Association, thank you so much for taking the time today.
Thanks for having me.